Chesapeake Employers Policyholder Webinar Series, Health Services Overview. Hello, I'm Dr. Nichelle Nesmith, Medical Utilization Specialist with Chesapeake Employers Insurance. Welcome to this segment of our Policyholder Webinar Series. I'm delighted to give you an overview of Chesapeake Employers Health Services Department. What differentiates Chesapeake Employers from other work comp carriers is the integration of an in-house medical team in the claims organization. At Chesapeake, we have a team of medical professionals embedded within the claims department. This is some of our health services department. Currently, our team consists of 23 nurses, 3 physicians, including myself with training in general surgery, and 2 orthopedic surgeons, a pharmacist, and a physical therapist. We work with Chesapeake's nurse case managers to ensure injured workers receive medical services that are appropriate and necessary. We provide oversight to ensure that medical services meet quality standards and are directed towards injury resolution. And we coordinate with our claims adjusters and safety consultants to help employers bring injured workers back to work as soon as possible. Our healthcare team ensures that the injured worker under our care receives prompt, high-quality medical care and appropriately prescribed treatments and medications. Our unique approach to managing claims is helping to contain costs, keep premiums low, and most important, get injured workers back to work as soon as medically possible. The cost structure of workers' compensation claims has changed significantly over time. Historically, indemnity or wage replacement costs for injured workers was the primary cost driver of workers' compensation insurance. Now, medical costs dominate. Consider this. In 1981, medical costs in Maryland represented approximately 28% of total claims costs. Today, medical costs make up about 52% of that cost. Medical inflation is a response to market changes and influence the pricing of medical goods and services. It is driven by the increasing cost in prescription drugs, procedures, medical devices, and advances in technology. The cost of drug research and development, as well as new specialty drugs, is very costly. Technology is revolutionizing healthcare. We see this in how 3-dimensional printers can now create human heart valves and ears. There are new advances in surgery and medical equipment every day. Controlling medical expenses for injured workers has become a strategic focus for Chesapeake Employers Insurance. Some of our efforts currently underway include medical management with a focus on early intervention, utilization management to deter overtreatment as well as undertreatment, peer reviews among a network of independent medical examiners to ensure reasonable and medically necessary care, focus on early intervention for back injuries, pain assessments in addressing alternatives to long-term opioids, and Chesapeake Employers' soft tissue injuries algorithm for assessing red flags early. Soft tissue injuries are sprains, strains, or contusions to muscles, ligaments, or tendons. The soft tissue algorithm is a guide we use which follows the natural healing progression of an injury. The algorithm helps identify expected healing, conservative treatment, medications, and recovery progress after a sprain, strain, or contusion within an expected time frame. Additional efforts around pharmaceuticals includes converting brand drugs to generic versions to avoid the high cost of brand drugs, conducting pharmacy reviews of compound drugs that provide limited therapeutic benefit but are very costly, reviewing expensive specialty drugs to ensure that they are medically necessary and related to the injury, utilizing a Chesapeake Employers drug formulary to identify drugs most commonly prescribed for specific work-type injuries, thereby avoiding payment of non-related drugs, limiting the number of opioid fills and then requiring pre-authorization, implementing Chesapeake Employers Pharmacy Fraud, Waste, and Abuse Program, and lastly, utilizing our opioid outreach program for educating injured workers and prescribers on opioid risk. This also includes providing the injured worker with a drug disposal bag for unused drugs or those no longer being taken, especially opioids, and at no cost to the injured worker. Our commitment to both the employers we insure and their injured workers under our care is best exemplified by Chesapeake Employers' response to the opioid crisis. Millions of Americans suffer from pain and are prescribed opioids. They can be prescribed for moderate to severe pain after surgery or injury or other healthcare conditions like cancer. Unfortunately, the risks include misuse, addiction, overdose, and death, all leading to the opioid crisis we see today. According to the United Nations International Narcotics Control Board, in 2014, the United States was the #1 consumer of hydrocodone, consuming 99.3% of the world's supply. Other common opioids are the generic oxycodone and the brand drugs OxyContin and Percocet. Opioid abuse is in part driven by the diversion and high street value for these drugs. Chesapeake Employers identified this trend in opioid overutilization in Maryland more than a decade ago. As a response to this trend, we created a pain management program, which includes a limit on the number of opioid prescription fills to 3 before requiring pre-authorization. Requests for prescriptions beyond the 3rd refill are thoroughly reviewed to ensure that ongoing opioid use is necessary. Functional restoration programs. This focused care for back pain sufferers aims to restore physical functioning, improve pain coping skills, reduce opioid medication dependency, promote a return to a productive lifestyle at work and at home, and limit the need for future medical treatments. Coordinated inpatient and outpatient pain management, weaning, and detox. Chesapeake Employers provides this treatment for injured workers under our care who have become dependent on excessive use of opioids. Pain management nurse. A dedicated nurse monitors claims with chronic opioid use and where there are mitigating issues such as noncompliance with treatment plans or there may be an opioid dependence issue. Pharmacist on staff who works with our external pharmacy benefits manager to monitor opioid drug utilization and prescriptions related to the work injury while addressing any safety concerns associated with medications. Legal roundtables. Our medical staff coordinates their medical findings with our claims and legal teams who are well versed in opioid use issues to evaluate if a case should be prepared for a hearing and how best to approach the issues, ensuring all necessary independent opinions have been obtained. Urine drug screen policy to verify that injured workers are actually taking their opioid medications and not diverting them for resale. Additionally, Chesapeake Employers is involved in community advocacy in the fight against opioid addiction in Maryland. We help to underwrite Maryland's prescription drug monitoring program, which requires medical providers to consult an online database before prescribing opioids. We produce radio and television public service announcements on the importance of prescription opioid addiction prevention. We created an opioid addiction prevention message kit for our policyholders. Employers can visit our website at www.ceiwc.com to download flyers and graphics and to order posters. Along with attorneys who specialize in Maryland labor and employment law, we published the Maryland Employer's Guide to Drug and Alcohol Testing and developing a drug testing program, The Building Blocks. Both are intended to help our policyholders deter, detect, and address the use and misuse of drugs, especially opioids. And each February, we sponsor Maryland Public Television's documentary, Breaking Heroin's Grip. Chesapeake Employers Insurance is committed to educating our policyholders about the dangers of prescription opioid addiction, and we're also bringing that message to business owners throughout Maryland. Through these combined efforts, Chesapeake Employers has seen a decrease in the number of injured workers under our care receiving opioids and the number of prescription opioids we fill. With the decline in the number of scripts and in the number of injured workers receiving opioids, we've also seen a continuous decline in opioid utilization and costs over the last 5 years. This concludes my presentation on Chesapeake's Health Services Department. If you have any questions about our services, please call our customer service department at 410-494-2000 or 1-800-264-4943. Thank you for watching. We encourage you to watch the other videos in Chesapeake Employers Policyholder Webinar Series.